Thank you for joining us for this session, Strokes Awareness Signs, with Dr. Paige Banas. Without further ado, I would like to pass it off to you.
Hi, everybody. Thanks for joining. Good morning. I think he might have gone over. If you have questions, you can raise your hand. We can make this interactive, and there should be some time for questions at the end too. Okay, so today we're going to talk all about stroke, and we can go to the next slide. I'll go through what exactly we're going to talk about. You can go again, next slide. Okay, so we're going to talk about what a stroke is, what the main causes are, what the risk factors are, what a stroke looks like, what the symptoms look like, how to treat a stroke, and how to prevent it. Next slide. Okay, so what is a stroke? So essentially, it's when you have a sudden loss of brain function to a very specific part of the brain, and it's due to some kind of disruption in the blood flow. There are two main types of strokes. There's ischemic, which is the main type of stroke that we see. This is when a blood vessel is blocked off, either by a blood clot or by plaque. And then there's hemorrhagic strokes, and this is where the blood vessel ruptures and blood kind of spills out into the brain. With both types, you have permanent brain damage as a result. It's just because these cells die when they are starved of oxygen and nutrients. Next slide. You might have also heard of TIA. Some people call these mini strokes. TIA just stands for transient ischemic attack, and the key word here is transient, or otherwise, temporary. So there's no permanent damage like there is with a stroke. Some people consider this a warning sign for a stroke, but symptoms they resolve in either like minutes or hours. So the person will go completely back to normal. Next slide. So what are some risk factors for stroke? Big ones are things like high blood pressure, high cholesterol, diabetes, smoking, atrial fibrillation or aflutter. This is a heart arrhythmia. Excessive alcohol use, drugs, sleep apnea, family history, all of these things. We'll talk about these in depth a little later on. Next slide. So what does a stroke look like? It can present in many different ways. It all just depends on what part of the brain is being affected. Just a quick, kind of anatomy lesson. It's kind of backwards, but the right side of the brain controls the left side of the body and vice versa. So the left side controls the right side. So usually people can have, symptoms like weakness, which will happen on one side of the body, or numbness. You can have facial droop, vision loss. And so this can look different ways. This isn't just like, oh, my vision's kind of blurry, I need to go to the eye doctor. It's like a piece of your vision is actually missing. Usually it's both eyes, but sometimes it can be just one eye, or like a curtain kind of coming down. People describe that as like a gray or black curtain coming down the eye in one eye. If you ever hear something like that or experience it, you want to be worried about stroke right away. Another common stroke symptom is problem speaking. This can look like either just slurred speech or aphasia. Aphasia is just a word that means trouble communicating. So people might have trouble expressing themselves or otherwise comprehending other people. And then you can have other kinds of symptoms sometimes with stroke, like your eyes might be pointed one side to the other. Sometimes people totally neglect one half of their body and they don't attend to it. Sometimes vertigo can be a stroke symptom. You can go to the next slide. So sometimes it's hard to tell if somebody's having a stroke. There are other conditions that have some overlap in terms of symptoms. Some big ones are like seizures or migraines. The way you can kind of try to tell the difference between a seizure and a stroke is a lot of time it will be accompanied by shaking or twitching in the extremities. A lot of times people will have some kind of reduced level of consciousness, but like stroke, their eyes can maybe point one way or the other. But sometimes with seizures also, they lose control of their bladder or bowel function. So that's another way you can try to tell the difference. Migraines also, sometimes people confuse those for a stroke because you can get things like numbness or vision changes along with a migraine. The way to tell the difference or not be worried about stroke per se is usually with the migraine, you get these neurologic kind of symptoms first. And then as the headache pain starts, those symptoms, the neuro symptoms kind of go away. And then it's probably just a migraine and not a stroke. Next slide. Okay, so we went through a bunch of symptoms that, are concerning for stroke, but what's an easy way you can kind of check for a stroke if, you're around somebody that you think that might be happening to? So there's this really easy acronym. It's called FAST. It stands for face drooping. So if you notice a facial droop on somebody, you can ask them to smile and make sure their smile looks symmetric on both sides. If you see that one side doesn't really, seem as strong or is drooping, that might be because they're having a stroke. Arm weakness is what the letter A stands for. So you can ask somebody to try to lift their arm up on their own. And if they have trouble lifting it because it's weak, you want to be worried about a stroke. S is for speech difficulty. So, if they're slurring their words or they're having trouble producing speech or like with finding words or searching for them, or if they're not able to understand what you're saying to them, like you're asking them to say their name or follow a specific command and they just kind of look at you and they don't follow it, you might want to be worried about a stroke. And then T is for time to call 911. And then we can go to the next slide. And why do we say call 911 immediately is because a lot of these treatments for stroke are time dependent. So you want to get your friend or family member or yourself, if you're worried about a stroke, to the hospital as soon as you possibly can, just because that'll give that person the most treatment options possible. Next slide. Okay, so just a little bit about how we treat strokes when a person comes to the hospital. So it kind of depends, on the type of stroke somebody's having, whether it's an ischemic stroke. So remember, like if a blood vessel is blocked off by a clot or some plaque, versus hemorrhagic stroke where you have bleeding into the brain. For ischemic stroke, you might, somebody might we have these clot busting medicines that go through the IV that we can give. Sometimes we send people for a catheter-based procedure to actually go in and remove the clot out. We do some different things with people's blood pressures. Sometimes people need, like a stent placed in their carotid artery to help keep that blood vessel open, or an endarterectomy, which is a procedure where they go and they actually try to clean the clot or the plaque out, kind of like scrape it out. And then we do use a lot of different medications for stroke. Very commonly, we put people on things like aspirin or Plavix, which is clopidogrel, or other kind of blood thinning agents. We also use a lot of cholesterol lowering medication. These are most commonly we use statins. And then we keep a close eye on things like blood sugars and whatnot. For hemorrhagic stroke, so the bleeding type stroke, the biggest thing we do is control the blood pressure. We like blood pressure to be nice and normal. If somebody's on blood thinning medications, we might give them something to reverse the action of that. Sometimes, you need a neurosurgeon to get involved, but it just depends case to case. Next slide. Okay, and then long-term, what do we do? Well, it's a combination of, medication and lifestyle changes. We'll talk about this more. And go next slide. Okay, so back to our risk factors that we touched on earlier. So we'll kind of break these down a little bit more so you guys know what ways you can help prevent a stroke in yourself or your loved ones. So risk factors that you can think of, there's modifiable ones, so ones that you can work on yourself or change. These are things like high blood pressure, high cholesterol, diabetes, smoking, being sedentary. There are some unmodifiable ones, like your age can't really do anything about, unfortunately, like race, ethnicity, sex, your family history. These ones you're kind of stuck with. Okay, next slide. Okay, so now we'll just go through some of these in more detail. So high blood pressure, you want to make sure you have a primary care physician, a PCP, to help follow along your blood pressure. You can easily obtain a home blood pressure cuff. You can get these at pharmacies, anywhere essentially. You might want to, if you get a home blood pressure cuff, it'd be good to just at least check it, on occasion. And if you notice that they're high, you might want to check it like once or twice a day. And the important thing is you want to write it down in a notebook or something. And that way, next time you go to your doctor, you can show them what your recordings have been. And then that way they can work with you if you need to be on medicine, or they can give you other recommendations in terms of like lifestyle changes to try to bring it down. If you are on medication for high blood pressure, you want to be good about taking it consistently. The blood pressure goal that we like for stroke patients is we want your blood pressure to be nice and normal. So a normal blood pressure is anything less than 130/80. And just one other way that you can kind of keep your blood pressure nice and low is to just keep an eye on your salt intake. Salt likes to attract water, and so the more salt and sodium you have in your diet, the higher your blood pressure could be. So the American Heart Association recommends no more than 2,300 milligrams a day, and ideally less than 1,500 milligrams per day. So it's a good idea to just keep an eye out on those nutrition labels and see how much you might actually get, because you might be surprised. It's pretty easy to get a lot of sodium. Okay, next slide. Okay, cholesterol. We also care about this a lot. Specifically with strokes, we care about LDL. That's the bad cholesterol. HDL is the good cholesterol. After somebody has a stroke, we want their LDL really, really low. So less than 70 is the number we look for. Medications that we use to help lower the LDL are statins. So these are like atorvastatin, rosuvastatin, simvastatin. There's all kinds of variations. There are other medications, but statins are, the ones that work the best to lower the LDL. And then what can you do otherwise, besides from medications? If you just want to avoid foods that have like high fat content, so things like fried food, a lot of butter, baked goods, red meat, these are all high in fat. Next slide. Okay. Another important risk factor is blood sugar or diabetes. You can have this managed by a primary care. Some people go to an endocrinologist for their diabetes. We want fasting blood sugar. So if you were to take your blood sugar first thing in the morning after not eating all night, we want it to be less than 100. For stroke patients and primary cares will check this lab value. It's called a hemoglobin A1C. So it's just a blood test, and it is recorded in a percentage, and it represents a 3-month average of blood sugars. And we like it to be less than 7. And then there are medications out there to help with diabetes. I'm sure a lot of people have heard of insulin. There's other things like metformin. There are ways you can work on your diet as well to help reduce your blood sugar. In this, you just need to avoid simple sugars. So, just like raw sugar, soda, like sugary coffee drinks, baked goods. And you want to keep a lot of like complex carbs in your diet. So like vegetables, whole grains, that kind of thing. Next slide. Okay, so atrial fibrillation. This is a heart arrhythmia. Arrhythmia just means it's an abnormal heart rhythm that makes you more prone to developing blood clots and then therefore a stroke. So the heart normally, pumps regularly, and with atrial fibrillation or AFib, it kind of like quivers, and so the blood can pool a little bit in the heart and form these tiny little blood clots. And sometimes they go up into the blood vessels into the neck and then up to the brain and then cause a stroke. Some people don't even know they have AFib. A lot of people can be asymptomatic. Some symptoms that might point towards AFib are things like palpitations, which are just fast, fluttery, or like pounding heartbeats. Some people experience things like chest pain, dizziness, fatigue, lightheadedness, shortness of breath. But some of these symptoms are kind of non-specific. They can happen in other conditions besides AFib. So that's why it's kind of hard to tell if you have it. If you're worried about it, you just want to talk to your primary care physician or a cardiologist, and they can recommend, further testing potentially. And if you are found to have AFib or do have it, sometimes people require a blood thinner. These are things like warfarin or apixaban. And the idea behind that is it's really just to help prevent a stroke. And so if you do have to take a blood thinner, you just want to be really good about taking your medicine and not miss any doses. Next slide. Okay, so what are some other kind of lifestyle habits? So smoking, just stay away. Smoking and tobacco, it's not good for your blood vessels. It makes them kind of harden. It can contribute to plaque buildup. You can drink alcohol, but you want to just keep it in moderation. So that means no more than 2 drinks a day for men and not more than 1 per day for women. And then illicit drugs, also not a good idea if you don't want to have a stroke. We've seen a lot of strokes in the hospital due to like methamphetamine use or cocaine. These are the big ones. Okay, next slide. Okay, a lot of people ask, what kind of diet can I follow to help reduce my risk of stroke? The one that has the most evidence out there in studies is called the Mediterranean diet. So this is a diet that's high in plant-based foods, so fruits, vegetable, legumes. You want to incorporate a lot of whole grains, and then lean white meats like fish or chicken, and kind of avoid things like red meat, pork. You want to kind of stay away from saturated fat, and then just, kind of like common sense things, just stay away from like high sugary contact items like fast food, that type of thing. Next slide. Okay, and then exercise. So we obviously recommend exercise for anybody if you want to reduce your risk of stroke. It's okay to exercise even if you've had a stroke. It all just depends, on kind of how much you're able to do. We recommend, at least like 30 minutes a day of light intensity exercise. That can be just even walking. If you're able to or can work up to it, you can do more like moderate intensity aerobic activity. We recommend like 10 minutes a day, 4 times a week, or if you can tolerate more like vigorous, intense activity, you could do like a 20 minutes a day or more for twice a week. And not only is exercise good for preventing recurrent stroke, I mean, it also is good just to help reduce stress, improve sleep if you have insomnia. So there's a lot of different benefits to just exercising in general. Okay, next slide. Some other risk factors for stroke that some people, you might not think about or know of. Sleep apnea is actually a big risk factor for stroke. So if you find that you snore at night a lot or don't feel rested in the morning, you might want to ask your primary care doctor about getting a sleep study to test for sleep apnea. And if you're found to have it, you do want to use a CPAP machine. There's all kinds of different ones out there now, so they have more comfortable ones available. Obesity is a risk factor for stroke. So, you want to try to lose weight if you can, and you keep an eye on your BMI at least on an annual basis. Kidney disease can also increase your risk for stroke. So if you have it, you just want to make sure you follow with a doctor and try to do what you can to keep things stable or prevent it from getting worse. Okay, next slide. And so what is it like for somebody after they've had a stroke? So stroke recovery, I'm not gonna lie, it can be a long road. Some people do really, really well, and depending on what kind of stroke they had and what treatment we were able to offer them right away. Some people will go on to have long-term impairment, physically. A lot of people have a lot of anxiety after a stroke because they're nervous about having another one. So, stroke recovery, we realize it can be a long road. Typically, it requires a lot of support in terms of, physical therapy or speech therapy, just from your family, things like that. But we have, designed rehab courses for patients after a stroke so they can participate in physical, occupational, or speech therapy as they need to. There's a wide range you can improve after a stroke to regain function. Usually we say you'll notice the most improvement within the first 6 months after a stroke, but you can improve even up to a year afterwards. And the brain, it does have the ability to heal itself. People ask all the time, well, like, how does the brain get better? You will have kind of a permanent scar in the brain, after the damage has been done. But your brain does have ways of kind of working around that. It will strengthen old connections. It'll reroute things to find like alternative routes to help you improve. So your brain does try to heal itself. It just needs some help, usually with some therapy too. Okay, next slide. And that's all I got. So anybody have any questions? I'm happy to answer anything. Yes, Pat. I don't know if you can unmute yourself or type your question in the chat box.
I've unmuted me. I didn't know that I could put it in the chat box.
Oh yeah, either way is fine.
Okay. I just recently had a friend that passed away from a stroke.
Oh, I'm so sorry.
Thank you. But this person also had dementia.
Okay.
So I don't know whether you know the answer to this or not, but people with dementia start thinking things. And also they was recently moved from an independent living place to a assisted living place. So
Okay.
my friend was seeing that he was being put in a system. He had to work out of a system.
Hmm.
So when he got into the assisted living, he was only there 3 days before he ended up being depressed. He just had no will,
Yeah.
because he was working in a system. So he did have the stroke. So could depression and being feeling like they're locked in a place could have brought on this stroke?
It's hard to say. I mean, the body, mind, soul are all connected, right?
Right.
There's no real data, I would say, to show at this point in time that depression and anxiety are independent risk factors for stroke, just meaning that they would cause a stroke in themselves. But, I can't say that, the depression, anxiety didn't affect him, in his body and, maybe his heart health, and then something, I don't know, it depends also kind of what type of stroke he had. But maybe if you're depressed and it raises your blood pressure, and that could increase your risk for stroke, I suppose. So it's a little hard to say. It could just be coincidence that it happened then, but it's possible that things were kind of related.
Yeah. He also had major heart surgery way back when. As a matter of fact, he had I can't think of the name of what he had put in his heart and everything. So I don't know whether that contributed to it or not. And when I went to see him, he was non-responsive. Even the nurse said that he's not responding to him, and he didn't respond to me and my talking to him and everything. So, I'm just not sure. I don't know whether the dementia had anything to do with that part too. Again, I think it was depression and all that stuff that got to it.
Yeah. I mean, I wouldn't say dementia is a risk factor for stroke. Actually, strokes, it's the opposite way around. Strokes are kind of a risk factor for developing dementia. So just because if you have a lot of strokes, sometimes that can lead to memory loss over time. So maybe he had some people, we find they had almost like silent strokes over time, and then their brain looks like they've had, some volume loss, or like it atrophies and shrinks down a little bit. But yeah, it sounds like he had probably some other risk factors for stroke with the heart surgery and stuff in the past.
Okay, thank you so much. I appreciate your answer. My question.
Oh yeah, absolutely. Any other questions?
Okay, just another question. Is your information or your presentation going to be on our website, on the FIBCO website?
Yeah, you should be able to on the website access like a profile for me, and it has a link to, I work at the Barrow Neurological Institute. It has a link to that website, which has some resources for stroke on it as well. and like information for our clinic and contact info and things. And I think the presentation will be available too on there if you need to go back in time and you wanted to reread something. I think it should be up there.
All right, thank you.
You're welcome. All right, well, thanks everybody for joining in. I hope you learned something, and yeah, if you have any questions, just reach out to us.